So in 2012, then CEO of Erasmus Medical Centre, Professor Hans Buehler, attended a course at Harvard Business School on value-based healthcare and returned with an ambitious plan for transforming his organisation into a true value innovator, one that placed better outcomes, lower costs and patient-centred care as its three primary goals. Today, in 2020, Erasmus MC has successfully implemented 9 ICHOM standard sets and uses these outcome measures. It is a true value innovator, with the goal of implementing 5 more standard sets this year, and Erasmus MC has been involved in the development of 14 other standard sets. But this transformation hasn't always been easy. As Professor of Healthcare Quality and Outcomes, you have been instrumental in creating this change. I'd like to talk to you today about the role of change management in this process. You've noted before any of these changes were made, you and other leaders first had to win the hearts and minds of the staff so that the entire organisation was brought into the benefits of value-based healthcare. Can you tell me how you did this?
Well, first by starting with those people who were already enthusiastic about the idea or about patient-centered care. So that was not that difficult. Finding about 6 disease teams who were enthusiastic in this for this concept. So we started with the 6 ones, I can mention them, so stroke, breast cancer, bladder cancer, obesity, Turner syndrome and cleft lip. So quite diversity of diseases, young, old, acute, chronic. And we started with an expert team, which was very small at that moment, 2.5 people. And we learned it from an external consultant to handle this. And in supporting those 6, we developed a blueprint for how to manage and how to support other disease teams. So from that moment on, we still were able to find other interested and enthusiastic clinicians to do that. So we, in 2019, we had about 30 teams which we supported. But that's certainly not the whole organization. That's only the beginning.
Okay. And how long did this process take?
I think 4 years. So we did 4 years for about 30 disease teams.
You've noted at times that you and other leaders had to push forward with projects despite skepticism within the organisation. When skeptics then saw the project's movement and impact, they quickly got on board. How did you know when to move forward despite resistance?
Well, again, the 30 were more or less very interested and enthusiastic, so that was not the big problem. But every year we needed to apply for budget. And every year we needed to defend ourselves for what we have gained and what we have organized. And indeed, again, some people were not always that positive. And at the 4th year of asking budget, they said, well, you have had budget for 4 years now. Now it should be in the normal organization to organize it, which is not true. So we started the discussion how to proceed from now on. It was 2019. So in that year, we discussed the fact that if we would proceed like this, we needed about 20 years to have the whole organization in this concept. So they asked us to make another plan and to implement it in the whole organization in a much more faster pace than what we have done so far. And for this plan, we received budget.
One key to change management is continuous communication about changes. How did Erasmus MC ensure that staff and patients were kept well informed?
I think we have not succeeded in this. There are a number of reasons for it. One reason is that we had an enormous development in the past 4 years because we moved into a complete new building. So we had this project done during the building of a very ambitious new hospital. Next to the implementation of a new EMR. So it was not very easy to do this in this period. That means that communication has been directed to those 2 projects and not really to our project. So we hope to change that now. And communication means communication to all people working in the hospital, nurses and physicians, but also administrative staff and IT and financial people, but certainly also to our patients. And that's another thing, two kinds of communications which is necessary to keep on discussing and describing and showing what we have done so far.
Do you think you would have benefited from dedicated resource to support the communication activity?
Yeah, absolutely. Yeah, but there were not in that time. So I think we have not succeeded at. Yeah.
Okay. What lessons from your experience implementing outcome measurement at Erasmus MC would you share with others just starting out?
Well, there are many, but I think the most important one is the fact that you send these kind of questionnaires to patients. You explain to them that it's part of your normal care. It's not extra, it's not a research project, it's part of your normal care, that you want to know how they're doing. And that you certainly discuss the results of those questionnaires with the patients. I think that's crucial. If that's not done, people are not doing it. They don't understand why you're doing it. So those two things, explain why you're doing it and discussing the results with them in the consultation room, either by a nurse specialist or by the physician, him or herself, or both.
And do you see much resistance from patients?
Not when these two things are carried out properly. And it is, both are not, the first thing to explain it is not that complicated, as long as you are able to explain that it is normal care and not extra or research. And the second one is more complex. To explain it, sometimes you need time. You don't have, as a physician, that much time. Or you need sometimes, when it's a complicated set of questions, you need a dashboard, which is suitable for discussion between a clinician and a patient. And that's something which is still work in progress, more kind of an iterative process, how this dashboard might help you. So it depends on the disease, it depends also somewhat on the kind of patient, but a dashboard can be interesting and useful to give one rapid overview of clinical and patient-reported outcome.
Can you tell us a little bit about the future and how you hope to implement standard sets across your entire organisation?
Yeah, well, since we have decided together with the board to spread the whole concept over the whole organisation, we will change from disease-specific to generic set, and we will use the ICHOM overall adult and pediatric outcome set. And that means that all the new patients from halfway this year will receive upfront the questionnaires, which makes communication and explanation even more challenging. They will fill in these questionnaires, hopefully, and we discuss it also together with the other complaints and other items of their problem. And then 6 months and 1 year later. So that's the overall set. Hopefully we can add disease-specific items very rapidly to that. So our main goal is to implement it in the whole organization in all kinds of patients.
Thank you very much.